13,000 employees, 104 clinics, and one name: Charite. It's more than a hospital. It's one of the most famous university clinics in the world. In 1710, it was founded as a quarantine facility for plague victims outside the city gates. As the Black Death never made it to Berlin, it was turned into a military hospital for the poor, the homeless, and for single mothers. The king decreed at the time, "It shall be called the Charite." Charite, a place of compassion. In the 19th century, it became the world center of medical science. Outstanding personalities left their mark here. The naturopath Hufeland, the ophthalmologist von Graefer, Otto Heubner, the founder of pediatrics, and Rudolf Virchow, who was a doctor, researcher, and politician at the same time. More than half of Germany's Nobel Prize laureates in medicine came from Berlin's medical establishment. But the glory years of the Charité were followed by devastation, when, during National Socialism, many excellent scientists perished or were forced to flee. Following World War II, the hospital staff managed to transform the Charité into the top hospital in Eastern Europe, despite international isolation and a scarcity of resources. After German reunification, all the medical institutions of the Humboldt and Free Universities were unified under the roof of the Charité. Today, it encompasses 4 locations and forms Europe's largest university clinic. In 2010, the Charité reviewed and celebrated its eventful 300-year history. Management and staff cycled the Tour de Charité and enjoyed Berlin's biggest birthday cake at the staff party. The year was marked by festive occasions, congresses, and exhibitions. With the founding of the World Health Summit, a new form of discussion forum for international politics and science was created. 20 years after reunification, the Charité has once again a voice that is heard in Berlin, across Germany, and throughout the world. Nearly 4,000 doctors with world-class qualifications work in 104 clinics and institutes. Alone, 250 professors contribute their knowledge and experience. No other clinic in Europe boasts as many competent physicians. No other hospital has as many patients as the Charité. Nearly 500,000 receive outpatient and inpatient treatment each year. 20 children are born each day at the Charité. Nearly 7,000 operations are performed every month. The entire spectrum of medical care is covered here. From common ailments like coronary disease and diabetes to rare and obscure diseases, doctors apply the latest scientific insights when treating their patients. At the Charité, there is an expert for everything, and hardly a disease that cannot be treated. There are social services like healthcare facilities for the homeless and an outpatient clinic for children. Because each person is different, specialists from various departments consult each other to determine the most effective treatment for a patient. In the treatment of cancer, for example. The Mitte, Benjamin Franklin and Virchow facilities each have an interdisciplinary tumor outpatient clinic. Innovation from diagnostics and therapy straight to the patient's bed. To make this happen, scientists work hand in hand at the Charité. In over 1,000 research projects, they combine innovative fundamental research with clinical studies. In the process, the Charité cooperates with renowned scientific organizations. Each year, the Charité raises up to 150 million euros in outside research funds, creating up to 3,000 new jobs. In addition, the Charité is the only medical faculty which has 4 projects in the Excellence Initiative. From the very beginning, the Charité's academic faculty has made the institution one of the most desirable educational establishments in the world. Currently, there are around 7,000 enrolled students, and 600 highly qualified graduates set out on their promising career paths each year. In 1999, the Charité launched Germany's first reformed medical studies program, which focused on practical instruction. As of winter 2010, all first semester students will receive instruction in the new Model Medical Studies program, which combines an understanding of the natural sciences with clinical practice from the very beginning. The Charite is involved with many international cooperative ventures, with partners as far afield as China, Japan, Australia and the United States. The Erasmus Exchange Program is the most comprehensive in Europe, along with 1,000 guest students from all over the world. Half of all students, including those who receive their doctor's degree, are women. That number, however, decreases in the postdoc phase, when many must balance teaching, research and patient care with starting a family. To support the careers of these superbly qualified and highly motivated women, the Charite has established a number of aid programs. For example, the Rahel Hirsch Scholarship, named after the Charite's first female professor, supports female doctors in the pursuit of their habilitation. The Charite was the first university clinic in Germany to receive the Family-Friendly Company and Family-Friendly University seals of quality. The Charite has a childcare center for its staff, with flexible operating hours on weekends and during the night. The Charite is proud of its elite. It is one of the few places within our society where top-level personnel from the fields of research, healthcare and science get involved with the hardship and pain, the living conditions and the needs of everyone, including the poor and the destitute. The Charite, it is the heart of a social city. Compassionate, scientific and entrepreneurial, that is the mission of the Charite Universitatsmedizin, Berlin.